Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel. Reminding you once again that if medication fixes your problem, that means you have a medical problem, not a mental problem. So if somebody's called you mentally ill in the past, you got to ask them, what do you mean mental? Because I can't point to your mental, I can only point to your brain chemistry, which is where I help people. Today I'm jumping on the video to talk about a situation that in some circles is actually controversial, and it can be posed simply as this: why would anybody give a medicine like Xanax, which has got addictive potential, to a patient who has alcoholism as a problem, addiction to alcohol? So fundamentally, when this happens, the question is, why would, is it good judgment or not, or are you potentiating or making someone's alcohol problem more likely? And a lot of times back, when I was first getting started in training and people would go to AA meetings and things, they'd say, well, my sponsor or my AA group doesn't want me to take any medicines that have addictive potential. The problem with that line of thinking is that if your underlying brain chemistry problem is why you drink excess alcohol, in other words, if alcohol is your form of medication, if it's your self-medication, then using alcohol becomes a problem for you. And so we know that people that have had terrible problems with anxiety might turn to pot, might turn to opiates, and might turn to alcohol. So in this circumstance, I'm dealing with a guy who basically came to me and said, Doc, I don't know that I would be able to maintain my sobriety without my Xanax. So if your GABA is low, we've talked about that in numerous videos before. If you have low GABA, that's what causes anxiety and panic. And if you use alcohol to settle yourself down, the problem with alcohol is that you need more and more over time to get the same effect. And as you get more and more into alcohol, the more addicted you become to it, to a point where it can be physically dangerous to stop alcohol when you're drinking, large amounts of it. So alcohol is not a great medication for that very reason. So when I am using medication that has addictive potential, there's two things to remember. Medicines like Xanax, which are the benzodiazepines, which I call the GABA boosters. If you have the need for those medicines because you have low GABA, if your GABA is here and it needs to be here, well, there is a range of medications that we use, and there's a guardrail that we try not to go above. And for Xanax, for example, that's 4 milligrams per day. So we don't want to go beyond 4 milligrams per day in taking care of GABA shortage with Xanax. Beyond that, you can increase the risk of addiction and tolerance. But if you stay at or below 4 milligrams a day, then basically what you're doing is using whatever you need to keep your GABA from being here and helping it stay there. And if that is what helps you not drink, and that is what helps you maintain your sobriety, then absolutely you should take that medicine. Now, no one's advocating that you take too much Xanax. No one's advocating that you abuse Xanax, party with Xanax, get drunk with Xanax, none of that stuff. What I am saying very clearly is that if you have self-medicated with alcohol, and that was your treatment of choice for your anxiety, and you transition to a medicine that has addictive potential, as long as you use it properly, as directed, if that's the key to your sobriety, then you should absolutely take the Xanax. And that is exactly why we give Xanax to patients who struggle with alcoholism. One day at a time, we help prevent them from drinking to self-medicate their own alcohol. That's the answer to that question. If you know somebody that struggles with addiction and substance abuse, if you know somebody who struggles with anxiety disorder, I strongly encourage you to speak to your primary care physician, find a psychiatrist, find anybody who will help you with your brain chemistry problem that's causing your anxiety and your panic attacks. Obviously, with the intent of helping you not abuse alcohol. So that's all I have today to say about that topic. I'm Dr. Dave, Psychiatry. Thanks for coming to see me today.